let's talk a little. We don't, in fact, drink the same amount of water and eat the same amount of salt every day, right? So that is a variable. But day after day after day, your blood pressure is relatively consistent across that. So if adding fluid is a sure way to increase cardiac output and blood pressure, right, then what is the system that controls this? So we have our first of our feedback loop system diagrams. All right. So here is the homeostatic challenge, right? We have an increased extracellular fluid volume, okay? Remember that the ECF and the plasma are freely communicate, okay? So fluid in one moves to the other very easily. So an increase in extracellular fluid volume will be an increase in blood volume, okay? So then now we're going to have increased filling pressure. True, we haven't talked about that, but that's fine. Increased venous return, that we have talked about, right? So more blood coming back to the heart because there's more blood circulating. The increased venous return is going to increase cardiac output, right? By our equation over here, that's going to increase arterial pressure directly, right? Because that's one of the factors. As arterial pressure increases, now we have pressure diuresis. So our urine output goes up, right? Because our pressure is high, urine output went up. That's like the second slide. That increase in urine output is going to reduce the amount of extracellular fluid volume and then turn off the feedback loop, right? So a homeostatic challenge resulted in an appropriate change which fixed that challenge. Now, if we look at what's happening at the capillary beds, that's this line, right? So an increase in cardiac output, we talked about this yesterday. If the cardiac output suddenly goes up, all over the body you have capillary beds that get a burst of flow, right? Because that came through the open sphincter. Well, the response to that burst of flow is vasoconstriction. We learned that yesterday too, right? So all over the body you have a burst of flow, vasoconstriction. Vasoconstriction in lots of places increases total peripheral resistance, which also increases arterial pressure, increasing urine output and shutting the system off a second way. All right, well, what about salt? That's where I was getting here. So this actually also happens if you increase your salt intake. Now, you still have to have access to water. Here's the thing with salt. We will balance our osmolarity with a vigor if we can. Okay, so if you give salt to patients and you get them, we never give salt, but you give them a nice big bag of potato chips, right? What happens next? Thirsty, right? So salt, we add salt to the patient, that increases their osmolarity. Increasing osmolarity is a powerful thirst trigger, right? So if the patient can get water, they will. That's the way to put it. Can all patients get water when they want? No. So if you have like a patient in the ICU who's on a ventilator, paralyzed and sedated, and you give them a bunch of salt, can they go fix their osmolarity? No, they cannot, right? So one of the more behaviors we take away from our patients, the more we have to take over for what they can't do, all right? But in a normal person, if you increase the salt, they'll drink, right? Also, if you increase the osmolarity by increasing the salt, they'll release antidiuretic hormone, right? Here's another question you can't answer yet, but you will by the time the blog's done. What does it do to volume? Well, antidiuretic hormone is going to have a tendency to reduce the reduction in volume, right? So antidiuretic hormone tends to support plasma volume. Now, it's just a hormone. It can't make water, all right? But it can keep you from losing water while you get water from somewhere else, okay? So both of those things result in this same pattern. So if this said increased sodium in the extracellular fluid, this same feedback loop would be present. The kidney can very easily get rid of excess free water. It's harder to get rid of excess salt. And that's because of we have to move salt using ATP. Water just follows along behind. So salt loads are harder to get rid of, but we see the same pattern.